We had the anatomy scan done. The doctor saw some things wrong with the heart. Her right ventricle and her heart stopped growing. We went and got a fetal echo done, and the world broke more for us. You're carrying a child for 9 months, and then you're being told you can't hold your child again. It's a hard thing to process. LillyMae was born on a Wednesday. She had her first heart cath on a Friday. She had fluid buildup around her heart. It wasn't pumping right anymore. They were optimistic, but certainly not as optimistic as I was at that time.
LillyMae had some seizures. She had some other stuff going on. Her numbers dropped. There were days where we didn't know if she would make it out of here. My sister, Katie, was born with heart and health issues, and she passed away 8 days later. I have a bicuspid aortic valve. My other sister has parachute mitral valve. My dad had a bicuspid aortic valve that was repaired here. We found out they're all affected by the same part of the DNA.
The Complex Fetal Care Center is a group of nurses and physicians and a counselor who are dedicated to supporting families who find out that their baby has some sort of suspected anomaly during pregnancy.
When a heart condition is identified before birth, it allows the OB, the MFM, the cardiologist, the surgeons, the imagers, the NICU, and the PICU to come together and create a plan for the delivery. We are all completely in communication about what the pathology is, so everyone is aware and nothing is a surprise.
We've been extremely blessed with amazing doctors and nurses. The kinship there of we're not in this journey alone. We have amazing people with us.
Maternal Fetal Medicine is the section of obstetrics and gynecology where we focus on patients who have medical issues that may make their pregnancies more complicated. And those medical issues can include both the mom, including things like blood pressure and diabetes, as well as the baby. Our patients are able to deliver their babies and then have access to the highest level of NICU, the floor directly above where they delivered. We have the only level 4 NICU between Philadelphia and Pittsburgh. We have the opportunity to think about not only the life that's coming, but also the person who's carrying that baby and whose health and well-being is just as important during the pregnancy as well as postpartum. Dr. Paulette cared enough to take the time to sit down and talk with me and make sure that I was okay. She just always gave an extra reassurance for me as mom. It's comforting. We spend a lot of time talking to each other. How can we optimize when the baby comes? And it's just about constant communication.
To truly take care of these patients in a full capacity, you need a whole team because you're caring for not only the mother, but also the newborn. And to be honest, the whole family.
She had her first open heart surgery being placed on ECMO that Friday. She comes out and everything's great. It was 51 days. But we got to go home. It was a really exciting day.
And then to learn with our newest little one, Madeline, that she had a heart defect. It was nowhere near the severity of LillyMae's, but still detrimental to her health and safety. She's got a good bill of health and looks like she's gonna live a great life.
The difference between your child and a child who doesn't have heart disease is you have to see us. And you may have some procedures along the way, you might have some surgeries along the way, but all of those things are to the end that your child can have a normal life, that they can pursue the careers that they want to, make a family, grow old, have grandkids. All those things are what we want and what we work for every day that they can achieve.
You're probably tired.
Family of 6 is new for us. Lots of glitter, lots of dresses, lots of emotions. But that's okay. I enjoy it. I wouldn't want it any other way.
If I could say thank you to Penn State Health and name every single doctor and nurse that I could, we'd be here a long time. Almost every single person we've been in contact with here has been phenomenal. We have some of the best healthcare here. I can never say thank you enough. They've given all 4 of our girls an amazing chance at a great life and it enhanced their lives.
The right physicians and nurses saved their lives. And they are really amazing. The only thing I could really say is thank you. I wouldn't have the family I have now without them. Sorry. But I wouldn't